So perfect. Okay, so let's start over again. Why should you schedule an eye exam? Simply to see clearly and comfortably, okay? The left side here depicts a typical eye chart that's used in the eye exam. And you can see on the right-hand side, it, again, doesn't really take that much prescription to be blurry in the distance. So these are all kind of examples of how potentially people, possibly you, are walking around with and without their glasses. And to put things in perspective, looking at the left side here at the 20/50 line or line number 4, anything below this line is considered great driving vision, but some of you may be squinting to see it clearly. And again, you all know why we don't like squinting. It can lead to headaches and potential crow's feet. Okay, so once more, I want you guys to get crow's feet. Well, no, I don't want you guys to get crow's feet, but if you're going to, we want it to be because you're happy and you're laughing and not because you're squinting to see the world. Okay, and then most importantly, please wear your glasses and have your prescription updated regularly. Okay, so let's go back to my original statement. Optometrists want you to schedule an eye exam yearly to see clearly and comfortably. And I think most people forget about the second part of that statement because it's so important. 20/20 doesn't mean clear vision. For most of you, you can see that the 20/20 in the center of the screen, it's a little bit out of focus and maybe even double. And then here's just a few more examples again. Some letters will move or jump around, but true clear vision is not just seeing the 20/20 line. We want to know, does your vision go in and out of focus? Do you see shadowing? Do you see two of the same image? Do you have headaches or eye strain? This could be the result of an incorrect prescription, muscle imbalance, fatigue, or some underlying health issue. Okay. All right. Now, whether you like Hillary Clinton or not, okay, do you remember when she wore these special glasses? She had a concussion at the time, which then resulted in a muscle imbalance to her eyes. And so because of that, she started seeing double vision. And so what they did with her eye exam is they went ahead and created this modification to her glasses. You can see it circled there. It's called Prism to align her eyes to reduce that double vision. Okay. For some people, this can actually be long-term. And so we want to be able to help you keep your eyes single and clear. And so don't worry, we can now make your glasses look a little bit nicer than this. They can actually, grind it into the frame so you don't see all those lines. Okay. All right, so to reiterate, in an eye exam, we not only check your distance and near vision, we also check how well your eyes are aligned, how well they move together, your focusing ability when you look from distance to reading, peripheral vision, eye-hand coordination, depth perception, and color vision. All these things affect everything that you do in your life, from driving to reading, work, social interaction. And so my goal always is to help you all see clearly and comfortably so you can go enjoy whatever it is in your life you want to enjoy. Okay. But that's not all. Okay. The most important part of getting an eye exam is checking for ocular disease in the front and the back of the eye. Okay. You can see on the screen there that there's all kinds of structures and tissue that help us see, from the eyelids to tear ducts, cornea, macula, retina, optic nerve. And so this makes sense that glasses and contact lenses only make you clear. And if any of the tissues are affected, then your vision can be impacted. For instance, when your contact lenses are not sitting right, or you decide to sleep in them overnight, or you keep them longer than you're supposed to, okay, the vision might fluctuate, or it even might be hard to see. This is because the surface of the eye actually begins to dry out, and it's like looking through a dirty windshield, okay? This is an example of when we stain the front surface of the eye to determine how dry your eyes are. And you can see all those little tiny spots. Those are the areas of dryness on that cornea, and this person is, might have a little difficulty seeing 20/20. Okay. So it's very important to see an eye doctor every year to make sure that your eyes are healthy enough to wear them. Also, because there's so many brands available, comfort and moisturization vary amongst all the brands, along with your own ocular health. So a lens that might be comfortable for you might not be comfortable for someone else. And then that obviously will then affect how well you see. As women, we're always more prone to dryness and irritation because of the makeup we wear as well. This is because there's preservatives in our makeup to make sure that it lasts for a few months, okay? But these preservatives can cause inflammation of the eyes and again, cause your vision to fluctuate. For those that are extremely sensitive to these preservatives, there's this company called Beauty Counter that is women-owned, and it's trying to create cleaner, quote unquote, makeup and skincare for women. Okay, on this link right here, they actually have something called a never list. The never list lists all kinds of preservatives to watch out for when choosing makeup and skincare, which could then potentially cause irritation and inflammation. Okay, but I completely understand that this might be a little tedious for a lot of women because it's not ideal to go and look through all the different lists of preservatives. And so if you can do anything, you need to at least try to do these things on this left side, okay? Which is number one, don't tightline your eye. So you can see on that area where there's that blue kind of like eyeliner, that basically will cover all your tear glands and prevent your tears from actually coming out. Okay, people don't talk about that, but it looks really pretty. Okay, lash extensions. The glue from the lash extensions is actually a little harsh for the lid itself. And so that can sometimes cause inflammation of the glands, which then causes more dry eye and then potentially some styes. So if you're going to do it, try to minimize how often you do it. And then lastly, waterproof makeup and glitter. They're just very difficult to remove. And so possibly if it's in the eyes, you can get irritation, dryness again, and then even corneal abrasions. Okay.
Wait a minute, Dr. Gamboa.
Yes, ma'am.
You said minimize application of lash extensions?
Yes.
So that's good. What?
Yes, I know. It's so sad because they do look really pretty.
Yes, so what you trying to tell me? I can't do the lashes no more?
I know a lot of people, they get really disappointed about it. Instead of doing the long glue, right? Sometimes individual lashes are better. Okay. There's also like magnetic magnetic lashes too. That's a little bit better. And then, some people, they try like the lash serums. They're not great, but just minimizing a lot of that stuff really will help you in the long term, right? So if you're gonna do it, just try to kind of just have better habits with it. And then of course, I actually forgot to put this on. If you use a specific lash cleanser to clean the lashes, that will actually help maintain the eye health too. Okay.
So someone just asked me, so what is the reasoning? Is it because the glue is heavy, or what's the reasoning in behind that?
So the glue, so even if people tell you that the glue is very, it's good for sensitive eyes, the glue is just harsh enough that it causes inflammation regardless of what they use, right? So when it gets inflamed, if you can see here, right, the glands, they line all
Nope,
these
your
areas.
screen went out.
Oh, it did? Should I stop?
Yeah, wait a minute, did it? Okay,
Nope.
nope, it went out on me. That's why. I'm sorry.
Okay.
It went out
No,
on my
that's okay. But yeah, so if you can see pretty much right where the lashes are, we've got all these oil glands that line those glands. The lashes that line the glands, and the glands get inflamed. And so the best way I can describe it, it's like having a pimple, right? Things get inflamed, the gland gets blocked, and then over time it just reduces your chances of going back to normal. So what I try to tell my patients, if you're just going to do it, maybe stick to just the top lashes if you can. Again, individual lashes, maybe just go to mascara. But yeah, I know that's a big one. That one made me really sad, but I tried it, and yep, my eyes are very dry, and I could only do it for a couple times. So yeah.
I'm sad right now, but continue.
No problem. Okay, so moving on. This slide's a little scary, but this leads me into the most popular eye condition that you've all heard of, called pink eye. Okay. But here's the thing, pink eye is not truly a pink eye. It's just the color of what your eye is, but there's so many conditions that create a pink or red eye. Now, we've already talked about 2, which is a dry eye and then potential corneal abrasion, but there's things like allergies, blepharitis, which is what the lash extensions can cause, also styes, iritis, which is internal inflammation in the eye, corneal ulcer, that's from wearing your contact lenses too long, right? Corneal abrasion, contact lens overwear, conjunctival hemorrhage, and then just so much more. So all these eyes look really, really scary, but this is also a great reason why we should not go to the emergency department, okay? I stress this, okay? The first place everyone thinks about when their eyes get really irritated, and if it's irritated enough, is they go to the emergency department without realizing that you should actually go see an eye doctor, okay? People have no idea. The emergency department isn't always equipped with the proper equipment to evaluate the eye, or even an eye doctor, ophthalmologist, and or optometrist, okay? So they can't really diagnose you properly. And so when that happens, patients can have complications, okay? For example, I'm just gonna show you this real quick, which looks a little scary, but this is a patient's cornea that was not treated properly at the emergency department. They were put on just a typical antibiotic, didn't see an eye doctor, and ended up with a corneal scar. And so as a result, this patient is actually no longer 20/20. Okay, so really important. Don't go to that emergency department. Okay, see an eye doctor. That's so important there. Okay.
Someone asked the question, can you
Yes.
say what the beauty website is again?
Oh yeah, so it's called, we'll go back so that you can go onto it. So it's called beautycounter.com. Okay. I know this is a really popular one. I think it starts with a T. Is it Trulia, or there's another makeup line that's supposed to be a lot cleaner as well. But what I like about this website specifically, it tells you exactly what preservatives that you shouldn't have in your products. And you'd be surprised, it's in a lot. So yeah.
Okay, thank you for that.
No problem. Okay, so let's go into more eye stuff, okay? So I'm sure you all heard about cataracts as well, okay? It's when the lens of the eye becomes very cloudy over time. And you can see in the top image, that's a normal eye, really dark pupil, light enters the eye, no problem. But then you can see on the bottom, there's a cataract, that whitish area in the middle, that's a cataract, okay? I'm gonna switch over to another diagram here. So this actually shows what happens when you get cataracts. Okay? The light on the left side enters the eye into the retina, and that's why we see clear. Okay, this is also a really good demonstration of if anything affects your cornea, the iris, like anything in the front of the eye, it makes sense that light will not enter the retina and then you can't see, okay, or you won't see as well. So with a cataract, you can see that that lens itself is a little bit more hazy, cloudy. So the light enters the eye with a scatter effect, and that's why we get blurry images. Same thing happens if this happens in the front of the eye, okay? And so getting a yearly eye exam basically will tell you if you're starting to develop a cataract. We maximize your vision with glasses. And then if we need to, we can recommend surgery, okay? But a yearly eye exam is what's going to tell you, okay? All right. So I'm going to go into this. This is, a typical picture of a retina. This is actually why we do dilated exams. So most people, when you go in to see an eye doctor, they will focus on the glasses and tell you that the back of the eye is okay, and then off you go. But you can really see there's so many structures in the back of the eye that help us see, specifically blood vessels, the dark spot in the middle, that is called the macula, okay? And that circle right there that looks like a sun, that's called the optic nerve. That's where it connects to your brain so you can process everything that you're seeing, okay? So looking at the left side, you can see that that looks, well, I can see that that looks pretty healthy. And if you look on the right side, there's these little subtle changes that I notice that this patient has. For example, with the vessels themselves, the vessels are slightly tortuous. And then I don't know if you can tell, but the vessels almost like kink on one another. There's a little bit of a tapering. This actually tells me that this patient has high blood pressure, okay? The other thing is you can also see that the artery, it's a one that's a little bit more yellow orange on the right side. That's actually cholesterol in the patient's blood vessels. So when I see patients like this, I have to make sure, is a primary care doctor seeing you and are they following you for this stuff? And if they are, I also want to make sure that it's being controlled. Okay. And so one more time, these two patients, one that's has a healthy retina and the one that has high blood pressure and cholesterol, they're both 20/20. So again, 20/20 is just not a good indicator of eye health. Okay. All right, and then this one. So we go back to the left side, left eye is looking really good, both 20/20, but you can see on the right side, this is diabetes. So diabetes shows up with kind of these focal areas of deposits, sometimes swelling, sometimes bleeding. This is because the sugar levels in the body, they get a little bit, well, they get a lot more elevated. And over the long term, we get bleeding and swelling in the back of the eye. Again, you'll never feel this, you'll never see this. And if you do, it's probably, it's probably that we have to manage you a little bit better with the diabetes. Okay, so these patients I typically send back to their primary care doctor or endocrinologist just to make sure their diabetic medication is working. Okay, so again, why should you schedule an eye exam yearly? To screen and manage vascular conditions like the high blood pressure, high cholesterol, diabetes. This might seem small, but this literally can be life-saving, okay? And I stress that because this is another example. Here, we have a patient that has a cholesterol plaque in their eye, okay? And it looks quite small, but if we think about it, this plaque is so close to the optic nerve, which then connects to the brain. So this patient is at high risk for a full-on stroke, okay? And so patients like this will actually send directly to get a stroke workup. They get imaging right away, and then they get sent to a cardiologist and primary care doctor within the next week or two to make sure that they're being followed regularly. Again, it's important to have an eye exam to supplement the medical care that you're having with your other doctors as well, okay? All right, there's two more health stuff and then I'll be almost done, okay? Here we go. So this is another patient that's 20/20. Another condition that people have probably heard of is glaucoma. Okay, glaucoma is where the pressure of your eye is too high that your eye cannot maintain that pressure. And so what happens is the vision actually will start to go away while your central vision is still good. Okay, and what's scary about this is that 90% of your vision can be gone before you even notice. This is shown on the right side of the screen. So this patient, if they're already noticing this amount of their vision is gone, it's already too late, okay? There's no way you can feel glaucoma. You can't technically see glaucoma in the beginning, but again, with an annual eye exam, we're constantly checking for glaucoma. So you don't have to do anything other than just show up to your eye exam. It's kind of easy. All right. And so, and lastly, macular degeneration. This is like another one that I like to focus on. This is where retinal changes can happen in the back of the eye. And this is typically worsened with smoking, poor blood pressure. And then if you also have a family history of this, okay. A lot of patients as well, if they're, around a lot of sun, that can increase your risk for something like this as well. Again, 20/20, no symptoms, but these small changes are happening in the back of the eye without you noticing. And so our hope is to diagnose it earlier in order to make preventative lifestyle changes, and then of course, slow down progression. Okay, and so truly with everything that we've talked about, maintaining a healthy diet, lifestyle, no smoking, sunglasses, this really helps prevent specifically macular degeneration, but also to just a lot of eye conditions in general. Okay, and so my hope always is when I talk to my patients, I try to make things easy. So, walk 10 minutes a day if you can. Sunglasses are super easy because they're really nice and stylish. We know smoking is just always bad, right? There's no benefits to smoking really, but I get for some people it helps take off the edge. And then of course, anytime you're eating stuff, I always say, put the rainbow on your plate. I don't like doing diets. I think diets they're hard to maintain, but if you look at your plate and see more browns and creams, then it's more steak and potatoes than it is vegetables and fruits and things like that. Okay, so putting the rainbow on your plate is really helpful. Okay. All right, so I think that's enough eye talk, but this is just a really quick review of some of the things that I thought of in that I typically go over in the eye exam, but I'm sure there's probably a lot more questions on maybe like, I don't know, contact lenses or makeup or skincare. I just didn't know how much you guys wanted me to delve into it. The biggest thing that I want everyone to take from today is that it's just important to schedule your next eye exam today if you haven't already. And then lastly, I just want to say thank you again to Miss Cassandra for all her hard work in bringing women together and creating a foundation to support all of us. I'm sure you all know how important it is to find your right tribe. And so please feel free to reach out if you need anything. And this is my info. If you guys need anything, you can reach me at the VA hospital and my private practice. And or if you just want to talk, that's fine too.
All
Okay.
right. Okay,
All
so
right.
I have two people that are
Okay.
asking, are you accepting new patients?
So I always accept new patients at the VA or in my practice. For me, what I really want for everyone when you come to see me, it's always about education and really going over like what we can do to help you. That's truly what I feel like we should do in eye care, right? And I know Cassandra loves this every single time we chit chat. Like it's all about just making sure like, we're all in a good place. And so I want to make sure eye care is the last thing for you guys to worry about. So yes, absolutely. That's a long-winded yes.
Okay, let me see, what's that?
So like when I go to the VA, like
Oh.
I have vision one day good and like the next
Okay,
day.
so I have another young lady that's talking about, she went to the VA and had
Mhm.
her eye exam one day and they
Okay.
said it was good. And then she went back the next day to the same VA,
Yeah,
same doctor, different doctor,
same thing.
same doctor, and they said her vision was bad.
Okay. So did they explain exactly what the reason was? Was it dryness? Was it
Okay,
cataract?
well, she's right here. You can ask her.
Yeah.
She's right here.
So I have diabetes,
Yep.
first of all. So I know like they're always checking the eyes and the feet and stuff like that. But
Mhm.
when I took my last vision, they said nothing had changed from the previous visit, but that my glasses prescription was changed.
Mm. So this could potentially be because of the diabetes. Okay. Typically, vision, it doesn't really change very often. And I say this because, we're grown, right? We're not growing anymore. And dramatic changes in vision doesn't really happen unless there's changes to the tissue of the eyes. So specifically, I've had patients where their diabetes is a little out of whack. And so their sugar levels will actually cause the eye to swell or deswell. And so we actually have prescription changes from that. I actually did have another patient, they had cataracts. Within 2 weeks, their vision had changed significantly because, again, their sugar levels were just out of control. So there's a lot of things that can cause the vision to change. And so that wouldn't be too surprising that you go one day and it's clear or fine, and then you go the next time and it's different. And which VA did you go to? Because you should come see me.
I've just told her.
Brown.
I've already told her. I said, look, you have to go with me. I talk about Lovell all the time and
Mhm.
how I love the care and concern that all of the providers have given me. I only had
Mhm.
one run-in with Women's Health. And since
Mhm.
then, that provider is no longer there. But outside of that, everyone has been amazing. You are amazing. I don't see no other eye doctor but you. It's like you're my personal and my private doctor. But
Yeah.
I love it. And I'm saying it for Facebookers. I'm a diabetic. And every time I go in to see Dr. Gamboa, she's, very attentive. If it's something she's concerned about, she'll make sure, wait a minute, go back, let's do this one more time. And just making sure that I'm okay. So, I will refer you to any and everybody
Mhm.
that can come out and see you, whether it's in your private practice in
Mhm.
Northfield or as a veteran at the VA in North Chicago.
Oh yeah. And I love that. I tell everyone that the difference between myself and other providers, and not to knock any providers, because we're all trained the same way, right? But it
Mhm.
is going to vary based off of their bedside manner, right? But the biggest one is control over schedule. I can't express, especially since COVID, a lot of doctors have gotten very, very overwhelmed. And so there's just a lot of, at least from what I've heard from my patients, is that sometimes doctors just aren't able to give the time that they need to the patients. And so they can only manage certain symptoms at a time. And then you have to come back again and again and again. So, what I really highlight for myself and also my other colleagues at the North Chicago VA too, is that we have set appointments every 30 minutes. Every doctor I can stand by, they all take care of all the veterans very, very well. And then separately with my private practice, we actually see patients every hour. I know that seems crazy to some people, but we don't spend the entire eye exam talking about like eyes, okay? Although if you want to, that's totally fine. But when it comes to eye care, I find that there are so many eye issues that people have, and they don't express it to their doctor because either there's not enough time or they're just not comfortable, right? And so, that's what I can, attest to with going to the optometry clinic at the North Chicago VA. We're all women. I don't know if you knew that, Cassandra. So
I
there's
didn't hear you. What did you say? I
we're
didn't hear
all
that.
we're all women now.
Are you serious? It's all women doctors back there now?
Yeah, it's all women
Yeah.
because yeah, so it's myself, it's Dr. Shelley Kim, Dr. Sarah Rogers. We now have Dr. Erin Martinez. She's a resident right now. She's about to go on staff. So yeah, it's like all women. So I really kind of push that too because I don't know, I feel like for women seeing women providers, I think it's so
Yes.
much more effective than seeing a man. And that's not to say discount some male doctors, but with women, I feel like we definitely have the compassion, and we just understand what we go through, right? Like the makeup and like the contact lenses, and yeah, like sometimes I want to be a little vain with my eyes, like I get it, right? And so I can be a little bit more compassionate about the things that we have because again, I'm a woman. So yeah, so that's the great thing about going to the North Chicago VA. We're all women now. And so
Yes.
yeah. So I would say go to North Chicago.
Excellent. I know I was on a panel a few weeks ago, and we were talking about healthcare and challenges and um, women healthcare at the VA. And I
Mhm,
didn't want to say anything bad about the other two, but I told them I will not go there. I am a Lovell lover, if you want to
mhm,
call it that. And I leave from Joliet and I go to Lovell. Because I've had nothing but excellent care there, from you name any and everything that I've gone there for, orthopedics to podiatry to uh, endocrine to ophthalmology, and I've had nothing but good providers. So, or should I
mhm,
say excellent providers. So I
mhm.
give you kudos and take my hat off to you.
Yeah, well, great. Um, yeah, so any other questions?
I don't see anything on Facebook other than
Okay.
we don't see your face. Okay, wait a minute,
Oh,
hold on. She said, if I see eye doctor at Jesse Brown, do I
uh-huh.
have to get referral to Lovell or just call to schedule appointment?
I think it's interchangeable. Here, let me stop my screen share and people can finally see my face. Maybe that's what would be better. Hold on.
Okay, they want to see you.
Okay. Hello. So I'm like cooped up in my exam room and my private practice. Let me see. Can I stop the screen share? Am I able to do that?
You should be, yeah.
There we go.
There you
Oh,
go.
hello. So yeah, it should be interchangeable. I know there's patients that are in Crown Point and they go past Crown Point and they go all the way to James A. Lovell. So I think it also depends on if you're trying to get some type of specialty, but optometry specifically, I think you can go anywhere really. So yeah.
Okay. All right, good, good, good. Let me see. Okay, I have one more question for you.
Okay.
So I know you stated like, I'm not really, I'll get eyelashes once in a while because I got my own. But do
Mhm.
you not recommend like so much, say like mascara and like eyeshadow or not eyeshadow, excuse me, like eyeliner, like liquid? Do you prefer, is it better like the pencil or like the liquid?
Honestly, okay, so I'm gonna tell you, and this is gonna be poo-poo on me. Well, poo-poo for like a lot of people because they don't want to do it. I have stopped wearing mascara for the last 6 years.
You have stopped what?
Wearing mascara for the last 6 years.
Are you
Here, I don't
serious?
know if you can see. Yeah, yeah, I got nothing. So I will tell you, and I didn't really emphasize too much on dryness, but so I was a contact lens wearer for 20 plus years, and I stopped wearing contact lenses because my eyes got so dry. And so
Mhm.
that's why I also really relate to a lot of women because all these things I've tried, but I have significant dry eye that I can't wear contact lenses as comfortably. And then also because of that, I can't wear makeup as comfortably. So the only time I wear eyeshadows is, when it's like a nice event, but I don't do anything on a daily basis. Mascara, same. I can do it for an event, but I just don't do it on a daily basis. And then, yeah, I mean, I think it just depends on how comfortable your eyes are. You're not going to do major damage if you do it every day because, everybody's comforts are different. But if we truly, truly want to talk about, maintaining the ocular surface and keeping these eyes healthy, I mean, nothing is better, right? And I
You're gonna
wish,
go natural.
right, to go natural, right? People don't want to hear that, but I think, at least for me during COVID, like it was actually a blessing because I was wearing a mask the whole time. So the only thing that my patients could see was just my eyes. And so I said, well, let me just go ahead and put an eyeliner. So the only thing that you see, if you see on my eyes, I actually just do a top liner. So that's good.
Mhm.
If you're going to do a bottom liner, you want to make sure, again, you don't line or tight line the eyes. You want to put it below the lashes.
I've
Um,
been wearing it wrong then. I always put it right there on that lid.
Well, a lot of these makeup gurus, right? They're so good at what they do, but I imagine that every eye doctor that's seen them, they see some form of dryness. So if you really want to minimize those symptoms, I'm not saying not to do it, right? Because nobody likes to hear no. But if you're gonna do it, just minimize and gauge your symptoms, but then also see an eye doctor so that they can look at the surface and make sure everything looks healthy. So yeah.
What about eye drops?
Eye drops. Oh, yeah, that was another topic I could have gone on. So for eye drops, brand is always important. Okay. I don't know if everybody heard there's this generic eye drop that it is correct. They've now recalled about 10 generic eye drops that had infections in the actual bottles themselves. It entered the eye, and then actually people had died. People died.
Oh, really?
They got blood infections from the eye drops.
So, look, the person that's here with me, she was like, wait a minute, I got eye drops in the car. I'm gonna run and go see.
Yeah. So
So okay, so
you can actually look this up. So I think it's called Ezra eye drops or whatever. These are generic eye drops that were made in India and they're distributed out of, I think someplace in like Jersey or whatever, but they're generic. And so I stress to all my patients that brand is always going to be better because they are making their eye drops to a higher standard. They need to get to 90+% effectivity or efficiency, just they need to be working majority of the time. When you do generics, they're cheaper for a reason. They're not as effective. And then of course they're preservatives. That one's okay, but again, that's
just
generic.
to equate, it's well, hold on. I don't know if you could have seen it. Let me take
Mhm.
my background off so
I
you
saw
can
it.
see.
Yep,
Oh, you saw it?
I did. So
Okay.
equate So, a lot of these stores, they have like a Target version, Walgreens version, all that stuff, right? If you look in the ingredients, they tend to be the same, but I just always caution, are they actually making the drops to a higher standard? Are they actually, using good ingredients in those bottles? And for a couple dollars more, maybe it's $5 more, it's just better to go brand. So the brands I recommend are like Refresh, Oasis, Cystine. Cystine and Refresh are actually provided by the VA. That's kind of nice, right? There's one called Blink. But anything that's generic, Clear Eyes, Visine, the marketing on that is wonderful, right? That's why everybody picks it up, right? But this is what can happen. These companies, they're not doing what they're supposed to, and now we've had people that have died from an eye drop, which is crazy to me. But anything can happen.
I know for me, it's the allergy eye drops is really one of the things. Because remember, I was doing my eye drops and you were like, well, Cassandra, you look good. And I was like, nope, I want to keep doing them. And you said, well, you don't have to. And so I stopped with the eye drops that was given, and we were fine. So what do you do about the allergy eye drops?
Yeah, so allergy eye drops, there is, this is the one I recommend to everyone. It's called Pataday, Pataday. This is a medication that actually was a prescription, and now it's gone over the counter, which is amazing. If you look it up, there's 3 different kinds, but I typically recommend that. They have that at the VA as well. They have actually 2 or 3. But with anti-allergy drops, again, you don't want to be using anything that a doctor hasn't prescribed to you, because typically a lot of the bottles will say itch relief, gets the itch out, gets the red out, but it's likely not a true anti-allergy, or it's just not effective enough. So using the anti-allergy drops, like specifically a brand, a prescription, whatever it is, using that regularly will help the allergies. And then I don't know if you know this, Cassandra, you can take your regular lubricant eye drops, you can refrigerate them, and then you can put it on their eyes. I don't know if I told you that before.
No, you didn't. And I have my moisturizer drops. I don't put them in the refrigerator, but I will start.
Yeah. So these are for those women that want to be a little bit more homeopathic. They don't want to do any medication. That's like a nice natural way to use lubricants. Just put them in the refrigerator and it acts as like a natural anti-allergy.
Okay, excellent. And I just had somebody on Facebook tell me that they just saw the eye doctor today. So yay. And another young lady that's a veteran, she said she is about to schedule with you today. Okay. She's going in scheduling. So I'm glad that we were able to do this, and hopefully we'll be able to do more eye classes to keep people up on their eyes, because that's just as important as everything else.
Yeah, so. And I think it'd be kind of cool to kind of get a poll on what does women want to know? Do we want to know more about like the makeup, skincare? Do we want to know more about like eye drops, contact lenses, or are there specific things that are happening to you guys that you guys want me to kind of go back and forth on? I am totally open to this. Like this is I think it's just amazing to be able to educate, because I feel like there's just not enough talk about how important your eyes are, and you only get 2, and it really is so easy to take care of them, but we just we get a lot of people and things that confuse us, and so you want to go to the eye care providers.
I really was impressed when I seen you were showing the eye once, how it looks, and you can just look in the eye and talk about high blood pressure, because that happened to someone that I know. They stopped taking, they're diabetic, and they stopped taking their diabetic medication, and their blood pressure went up, and now their vision is completely gone. They're partially blind because of that. So I recommend for all of my diabetics that's out there listening to podiatry, make sure you go see a podiatrist on a regular. You go
Yes.
see your endocrine doctor on a regular to make sure that your levels and everything is okay. But
Mhm.
don't forget to go check on your eyes. And a lot of times diabetics will forget about the eye. They don't think that it matters, but I try to tell them that diabetes attacks your organs and it attacks different parts. Where is with me, it didn't attack my eyes like that. It didn't attack my kidneys, but it
Mhm.
attacked my nerves. So I have neuropathy. So
Mhm.
I'm going to see the podiatrist more than I am the
Mhm.
eye doctor, but I make sure that I come to
Mhm.
you what?
Just
Once
once
a
a
year,
year.
twice a year if I have to.
Yeah.
Exactly. So we have to be very cognizant of this. And I appreciate you for accepting the challenge to come on and talk to everyone about eye care. Did you like the flyer, the eye in you?
I
All
did.
eyes on
That's
you?
like a nice pun to it.
Yes, all eyes on
Yeah.
you.
No, I loved it. And I'm really glad you asked me to do this. I just, it's the first time I've done a Zoom call, so I apologize everybody for all the technical difficulties. We'll know next time how to do it, and they'll be like quick and fast. And I'm just excited to be able to kind of share all the knowledge and then just connect with you all. Like that's the point of all of this when it comes to like healthcare. We hope that you connect with your doctor, you talk to them and let them know what's going on, and that you actually want to see them. Like you should want to see your not just your eye doctor, but just any doctor, right?
Mhm.
If it's a chore and you feel like you don't like them, yeah, it's not going to go well.
Well, that's part of Top Flight's mission, is to encourage and promote the overall health and wellness of women, veteran, and women in the community. So
Mhm.
we're part of the community. And then the vision is what? To bring partners to partner in with
Yeah.
other organizations to make sure that we're hitting that mission. And I think today we hit the mission. We hit the mission on a vision.
Yes. Awesome.
All
Great.
right. Well, I appreciate you. I appreciate all of my Facebook viewers. I'm sending you a heart
Thank
and
you.
I thank you. I'm going to stop the recording on Facebook Live and the recording to my